565.
So, welcome to the National Hispanic Cannabis Council Education Committee Forum on Cannabis 101, where we'll bring medical professionals together to demystify the health and wellness power of cannabis and break down the Latino community's long-held cultural taboos and beliefs on cannabis.
Good afternoon, everyone. My name is Dr. Craig Antel. I'm a member of the National Hispanic Cannabis Council, and I'm here today with my partner, Dr. Philip Burns. I trained at the NYU Rusk Institute of Rehabilitation. I spent 15 years in private practice in Manhattan, followed by 5 years as director of ambulatory orthopedic rehabilitation at NYU Langone. My current primary focus is medical cannabis, as well as sports-related injuries. My partner, Dr. Burns, will do his introduction.
I'm Dr. Philip Burns. I've been practicing for over 20 years, completing specialty training in physical medicine and rehabilitation at NYU. And I've been in private practice, as I said, specializing in orthopedic rehab and prosthetics and pain management.
So thank you, everyone, for joining us today. We're here speaking on behalf of the National Hispanic Cannabis Council. The National Hispanic Cannabis Council's mission is to educate the U.S. Hispanic community on the health, wellness, and economic aspects of cannabis to empower their support and participation in the industry to help demystify through educational programs such as this, the health and wellness power of cannabis to break down long-held cultural taboos and beliefs on cannabis. We're going to begin the show now, and this is going to be a conversation between Dr. Burns and myself on insomnia and cannabis. We've been in practice together for close to 3 decades at this point. This should certainly be informative as well as fun at the same time. So I'm going to start off with the questions here on my end. And the first talking point or question we're really going to hit is cannabis and sleep. And Dr. Burns, is cannabis and sleep a good combination?
Well, funny you mention that, right? Cannabis is widely used for sleep, both recreationally and prescribed through medical users. Many patients self-treat with cannabis. 70% of young adults that casually use cannabis report they're doing so to aid with sleep. And 50% of long-term users feel that cannabis improves their sleep. 85% of patients who are taking cannabis for medical reasons report that the cannabis is improving their sleep. And the association goes deeper, right? So the endocannabinoid system, which we've discussed in previous talks, is linked to the circadian rhythm, which is basically your sleep-wake cycle. And the cannabinoid receptors, particularly CB1 in the brain, regulate sleep by sending messages that raise a compound called adenosine, which promotes sleep and suppresses brain arousal.
Thank you. It's there's a lot of misconceptions out there with regards to prescribing cannabis for sleeping. And I know in my private practice, and I know in your private practice, that a lot of our referrals came from other practitioners who were really not comfortable in prescribing cannabis. And they did have a lot of misconceptions behind the plant and the medication itself. Do you mind touching on any of those for a moment?
Well, I think that a lot of the misconceptions come by the way of a lack of understanding and education. And that's actually the purpose of this talk, right? So whether people just don't have a comfort level with cannabis, the diverse amount of strains and selection, and which one is right for the patient. The combination of the patient's overall clinical picture in terms of their other medical diagnoses that they have in addition to the lack of sleep, different medications they're on, et cetera. So really the misconceptions come more from a lack of understanding than the product itself.
Thank you. There are a lot of sleep disorders out there, and you and I discuss this frequently when we're treating patients. And as practicing physicians, we always like to know what the underlying cause of a symptom is. For example, someone comes in and their knee hurts, we need to know why their knee hurts. And it's really the same with insomnia. So one of the first things that we really should touch on here is, what is insomnia? You know, and really what insomnia is by definition is it's difficult to fall asleep, or it's difficult to stay asleep at night. You might wake up a little bit too early in the morning. And we really need to address the reason why we have this insomnia. It could be from pain, anxiety, depression, other medication use, underlying medical conditions, caffeine use, a big meal at bedtime, alcohol use, and age. There are also some other sleep disorders out there, you know, or things that cause sleep disorder, which I touched on. We could also add PTSD. We could add restless leg syndrome here as well. As recently as 2020, 8% of the adult use population in the US was using cannabis or sleeping meds on a daily basis. With that said, cannabis does affect the sleep architecture of a person's sleep. And you mentioned the adenosine there, but there are different phases of sleep, and each of them are important for us to touch on a little bit. There's deep sleep and there's REM sleep, and those are the two big ones. So do you mind touching on deep sleep for a moment and what that means to our patients out there?
Yeah.
So important.
We can get into the different phases of sleep, you know. So stage one, that's when you just drift off. You're not conscious to your surroundings, but you're easily woken if someone jars you. Your muscles are relaxing. There's slow eye movements. Alpha waves are predominant in the in brain. And we go into stage two, which is when you're really more full asleep, a little more difficult to wake you up. Then you get into stage three, a deeper sleep, right? And that's what you were alluding to. Slow brain waves, hard to wake somebody up. It's more restorative sleep. It's your deep sleep, right? It's more refreshing. And that's the sort of restful sleep, right? And then you get into REM sleep, right? Which is, REM stands for rapid eye motion. That's the time when you're dreaming, all right? And you will fluctuate in and out of these phases throughout the night, in usually a 90-minute cycle.
All of these phases of sleep are important, and they all kind of come into play here with overall insomnia. The deep sleep that we mentioned, that's the sleep that gives you that restorative rest, and you wake up in the morning and you feel really great. The REM sleep, though, is a little trickier here, and I just want to talk about that for another minute. When we mentioned insomnia a moment ago, we both agreed it's important to know why someone isn't sleeping, and then we can treat them properly. REM sleep is important because REM sleep deals with dreaming, and dreams deal with memories as well. And folks that suffer from post-traumatic stress disorder have a very difficult time sleeping. And cannabis has been shown to be a significant benefit in patients that have PTSD by the cannabis decreasing the amount of REM sleep and thus decreasing the amount of dreams overall. And that also translates into how the patient feels during the day. As we continue kind of moving forward here with this, doctors always ask me, and I'm sure they ask you as well, do you recommend cannabis for your patients that can't sleep? Or do you go to something a little more, what I'll call traditional or accepted?
Well, as with all treatment plans, right? A multi-phase approach is usually best, right? So we want to practice good sleep hygiene, and we can get into that. But a lot of the traditional or more prescribed pharmacologic medications for sleep come with associated risk factors, everything from somnolence if someone wakes up, to use the restroom, whatever at night, and their balance is affected. That's not favorable, particularly in the elderly. These medications may interact with other medications that the patients are on. So, sort of a diverse or a comprehensive approach, along with being sort of respectful of the patient's overall clinical picture and additional medications that they're on. We do recommend cannabis as a treatment alternative, or at least as an adjunct in combating insomnia.
Yeah, I know in my own clinical experience, and I've treated probably close to 1,000 New York State cannabis medical patients at this point. One of the first things that the patient would always come in and tell me is that they had, open quotes, the best sleep they've had in years, close quotes, with using the cannabis product. And much as you just touched on, there is a multitude of reasons for such, and we're going to get a little bit more granular with that in a minute. How do patients know if cannabis is right or not for them in really treating their sleep troubles? And that's something that comes to both of us all of the time. And it really comes down to a history of the patient, which we were alluding to before. And it's infrequent that we'll find someone that we wouldn't recommend a cannabis product for to help with sleep. This comes to me as well, and I always kind of smile with it, and I usually give a half-hearted answer to it. Dr. Burns, is there any risk of not waking up in the morning?
No. So cannabis does not have, there's no receptors in the brainstem for cannabis. So the overdose that we see in the opioids doesn't exist with cannabis. So the safety profile is obviously much greater. And we discussed this in the pain talk about cannabis as a viable option for the pain management because of this.
And I definitely agree with you across the board on that. And the other thing why we like to prescribe cannabis or recommend cannabis is, as physicians, we have very little concern with a cross-reactivity of other medications that the patient is currently taking. And with a lot of the other pharmaceuticals that we prescribe, that's always on the top of the worry list. What I tell people when they ask me whether they're going to overdose on their bag of gummies or whether they're going to overdose on something else is I tell them to enjoy your product, and I will be sure to see you first thing in the morning when you wake up. We have another, topic here, which we kind of touched on. And, what happens to someone if they don't get high quality sleep? And, the reality is that the recovery process for whatever else they're going through certainly drags out. Their daytime performance suffers and their social interactions suffer.
Yeah. Other issues include weight gain, risk of cardiovascular disease, diabetes, impacts your immunity. Like you said, memory, function, accidents, lack of performance at work, social interaction, family strain. So sleep is paramount to quality of life. And
Do you worry about your patients with long-term use with the cannabis product?
no, I don't have a particular long-term use concern. We do want to address the underlying cause of the insomnia, and we want
What
to
I
be
see more on,
in our approach. Increased use or dosage may be sometimes necessary to titrate to an effect, but generally speaking, a long-term issue we do not see. I'm sorry, go ahead.
yeah, the only thing I've seen really on a long-term issue in my practice is patients developing tolerance over time.
Mhm.
And which is why I always kind of start folks slow and ramp them up. As we're talking about long-term use, I just want to touch on the acute user, or the person who comes in that's never had a cannabis product before, and we want to use cannabis to help them sleep. About 10 or 15 minutes ago, you spoke about how THC has a sedating effect. However, in our new user who has never had a THC-based product before, it can actually be the opposite. And it can give them a little bit more of an arousal effect just because they're not experienced with it. So we always like to start slow, start low, and gradually raise up as we need to. There's a lot of misconceptions out there, Dr. Burns, and there's a lot of generalizations about cannabis and sleep that really are just not true at all. And, on the simplest side, we talk about an indica and a sativa. And, folks like to say indica equals in the couch. And the sativa gets you up and going and you're active throughout the day.
Mm-hmm.
However, that's a real broad generalization and certainly a disservice to anyone who's looking for a proper cannabis-based product to help with their insomnia. And when we look at product selection, we look at a couple of different things. One is we look at terpene profile, very important here, and something that's overlooked often. And we also look at the genetics of the strains, which I mentioned before, whether it's an indica, a sativa, or a hybrid of both. On the terpene end, there's really two major terpenes out there that we focus on for the most part with sleep. First is mycerine, which does have sedative properties. It has anti-inflammatory and pain-relieving properties, and it's sleep-promoting. And the next big one is beta-carotene, which works great for anxiety, for PTSD.
Mm-hmm.
And this terpene actually binds to the same receptors as THC. Then we look at the cannabinoids. And of course, the most popular one out there is CBD, CBD, CBD. Every time we turn around, someone's shaking some CBD at us. But a more important one to this combination or this conversation actually is CBN. And we're aware that CBN forms when the THC oxidizes, and a high concentration of CBN in a product tends to be a little bit more sedating. And then lastly, we have to think as physicians and patients here, bioavailability. And how much of the product actually that you take does your body use or get? And if you inhale or smoke something, the bioavailability is 56%, meaning 56% of that product is bioavailable to you. On an oral, which is non-smoked, it's anywhere from 4% to 20%. And then on a topical, it's even less yet. And we look at the time to peak effect. So if we inhale something or smoke it, it goes right to the blood-brain barrier. We get that effect within 10 minutes as to peak THC concentration. where a patient who might be using a sublingual or a tincture or an edible, they're going to have kind of a longer onset of action. Is there any advice that you give your new user patient with regards to this?
As always, start low and go slow, right? So someone that's cannabis naive, new to cannabis, right? We don't want to sort of overshoot, right? And we don't know how much endocannabinoids they are producing on a regular basis as well. So starting low, titrating up to the desired effect is always the best option.
There was a big study that was done, and it was a retrospective study, and it looked at basically 8,500 patients. And these 8,500 patients were using cannabis for sleep. And the study broke down to what form of cannabis they were using, whether it was, inhalable or an edible or a tincture, and what products they were using, whether they were more indica-based or sativa-based, and also what the underlying condition was. And they kept that kind of streamlined. And the underlying conditions were very simple. It was primary insomnia, meaning you can't sleep for a multitude of reasons. Insomnia that was secondary to depression. Mm-hmm. And greater than 80% of people who are clinically depressed have insomnia. Or was the insomnia due to anxiety? 70 to 90% of the people with anxiety have insomnia. Or was it due to both? That the person's depressed and they're anxious. So we had a couple of different variables here. And what the study looked at was a sativa dominant strain, a sativa hybrid strain, an indica dominant, an indica hybrid, a 1-to-1 ratio, or a high CBD product. So in essence, we had 6 variables here. Mm-hmm. To cut to the end of the study, all the groups in the THC version fared better than just the straight up CBD group. For the depression, an indica dominant strain was shown to be best. For anxiety, an indica dominant and an indica hybrid work equally as well. And for depression and anxiety, it was more of an indica hybrid. This is very important because we need to know what we're treating or what's causing the insomnia to relieve the insomnia. And there are different formulations and there are different strains out there. And making that choice correctly at the onset will make all the difference in the response. Because don't forget, a lot of insomnia is secondary to other conditions. It was also broken down a little bit further as to what product form works best for people. So patients that are depressed and they can't sleep, they have insomnia because of it, they responded best to flower form. Patients who had insomnia due to anxiety, they were anxious, responded well to flower, edibles, and tinctures to an even degree. And then the depression and the anxiety also went more towards flower, but all helped. So getting to the root cause of the insomnia hopes to guide us as physicians as to the specific treatment. So an indica-only product, when our patients go to a dispensary, whether it's medical or adult use, don't just ask for an indica-only product. It might not be right for you. A high THC product might not be right for you. A combination might not be right for you. And just a pure CBD might not be right. What I'm emphasizing here is we need to understand as providers and patients what's causing our insomnia so we could effectively treat it. Anecdotally, you and I have both had significant experience and significant positive patient feedback with using medical cannabis for sleep. And we have both been very successful in weaning patients off their other prescribed sleep medication and or anxiolytics for anxiety, antidepressants for depression, and pain for pain by using properly formulated cannabis products. So as the data comes in and as the research continues to come on board, what we see as practicing doctors who are out there every single day, we see the positive benefits. We are not seeing many negative side effects at all. And we've been very successful in streamlining patients' medication use. Now, big caveat here, please do not stop your sleeping pills and transition to cannabis. Dr. Burns, you want to talk about that for a minute?
So many of the medications used for sleep need to be effectively weaned down or decreased dose successfully over time and before eliminated. And stopping abruptly can cause different issues, everywhere from withdrawal symptoms to seizure to other unpleasant experiences. So always engage with your healthcare provider. Discuss the use of cannabis in conjunction with the medications you're on, and advocate for yourself and your own healthcare.
Thank you. And insomnia is something that no one who's watching this is going to avoid. It's just the reality of it. As we age, our sleep-wake patterns change, and we tend to go to bed earlier. We tend to wake up earlier. As we age, we develop comorbid medical conditions. We develop orthopedic conditions that cause pain. As we age, we develop more problems. I wish I could be 10 forever without a worry in the world. Family, social, economic issues, this all keeps us up at night. So also, women go through hormonal changes, and there's just times against us with this. So at some point in time, everyone is going to face insomnia. We feel cannabis, medical cannabis, is an excellent option and an excellent choice. We see the benefit personally, professionally with our patients on a daily basis. It's safe if used in the right form and effective and used in the right form and manner. With that said, I believe we may have some questions or two out here. Dr. Burns, is there anything about cannabis and insomnia on a high level that we really didn't touch on today that you can think of?
Offhand, I feel like it was a comprehensive review. Like you were discussing with relationship to the particular strains, the ratio of the cannabinoids, the CBD, THC, and the respective ratios for high THC, low CBD, and vice versa, along with the patient's overall clinical picture and other comorbidities. Patients would do well to discuss this with their own healthcare provider, whether it's their physician, their nurse practitioner, engage with the pharmacist, engage with the bud tenders. And like I said, start low, go slow, work through the process. But generally speaking, practice good sleep hygiene. That includes all the things that you've discussed in terms of going to sleep at the same time, lights off, no caffeine products after 3, no strenuous exercise before bedtime, etc. And it's really a comprehensive approach, but with cannabis involved. I think patients will, like you said, they're not going to avoid insomnia, but I think the treatments that are available, cannabis as an option, can go well or do well to give the patient the positive outcome they're seeking.
Excellent. We do have a question here that came in, and it is, do you recommend medication with CBD or THC or both for sleeping? And what is the proper dosing for sleeping? So we talked about proper dosing here a little bit. And the other thing which we didn't speak about really is whether you're a native cannabis user or an experienced cannabis user. So a native cannabis user is someone who's never had the product before. Thus, they require a lower dose, where someone who's more of an experienced user will require a higher dose. When we talk about CBD or my bad, we had a power failure. When we talk about THC or CBD or both, we really need to talk about THC and which product it's coming out of and which product we're using at that time. And as far as CBD goes, looking for a product that's slightly higher in a CBN concentration that has been shown to help with sleep would be more beneficial. What we also see with long-term chronic users is they do tend to require a higher dose of THC or cannabis in order to get the desired sleep effect. That was the question that we had come in. There was another study that I just want to talk about for 1 minute that is really current, of February 7 of 2023, and it came from the Sleep Foundation, and it did report that 70% of young adults are currently using cannabis products for sleep. 50% of chronic users report better sleep, and 85% of patients with chronic pain report better sleep. So to reiterate, we need to know the underlying cause. If we know the cause of the insomnia, we will be able to treat it. Any other questions from anyone? Nothing I see here yet. All right. If there are no further questions, I hope everyone enjoyed the talk on insomnia and cannabis. As you can see, it's not a straightforward picture here. We have to look at the underlying conditions. We have to look at the individual themselves, and we have to take the time to formulate that proper treatment regimen. Much like Dr. Burns said, reach out to your physician who is the prescriber. And in the medical cannabis setting, certainly take advantage of the pharmacist and the other healthcare providers that are on staff to help you make the appropriate educated choice. I hope this was informative. Any questions or anything, please feel free to reach out to us at the NHCC. We appreciate the time that you spent watching this, and have a great day.
Have a great day. Thank you.
Thank you.